All right. Well, good evening, everybody. My name is Dr. Gigi El-Bayoumi, founding director of the Rodham Institute at GW School of Medicine. Welcome. I think it's going to be important to spend a little bit of time today talking about the J&J vaccine and to put it into some perspective. Over a week ago now, we vaccinated 886 people in Ward 8 with the Johnson & Johnson vaccine. And at the time that we were doing the educational activities for the community-based organizations who were then registering patients, I said I would never recommend anything that I didn't do for myself or that I didn't recommend for my family member. So just for full transparency, my nephew, my niece, and my brother all got Johnson & Johnson vaccine. And I'm not worried. And let me tell you why. I'm not worried because there were of the clots that you've probably read about by now or heard about or seen on TV, there have been 8 in 6 million people. Because remember that it's just a one-time dose. So 8 people, and all 8 people had very similar characteristics. They were between 18 and I think 45. They were all women. And all of the clots happened within about 3 weeks. The reason that it's felt, this is a hypothesis about why it happened in young women, is because women in general are more susceptible to immune phenomenon. That's why things like lupus or MS as diseases are more common in women than they are in men. However, when we looked at how those women did with the clot, and that could be clot anywhere, so you could have headache or shortness of breath or abdominal pain or leg swelling, it was really the treatment that got people into trouble, not the clot per se. In other words, we usually will use heparin, and when people used heparin to treat these women, they had some problems with side effects. And so if, God forbid, anybody who's gotten a Johnson & Johnson vaccine has any severe headache or shortness of breath or abdominal pain or calf pain, call your doctor. And if you end up for whatever reason in the emergency department, just make sure to tell the people, the care team taking care of you, that you've gotten the Johnson & Johnson vaccine. But just to give you some perspective, and then I'll introduce Dr. Huerta, who's here, and our wonderful translator, Ms. Kayla McKinnon. But just to give you some perspective, your chance of dying from COVID is at least 100 times higher, if not 1,000 times higher, I have to do the math, than having any event. Actually, no, it's a lot higher than that. It's at least 1,000 times higher from dying from the COVID than the vaccine. And people will say, well, you see, there's a problem. Well, with every medication that we take, with every vaccine that we take, there is a risk involved. And actually, aspirin probably has more people dying from aspirin use than the vaccine, just to give you some perspective. So of course, everybody's nervous, and I don't mean in any way to minimize anybody's fear of any medicine or vaccine, but in a way this should be reassuring, because it tells you that the data monitoring boards of the CDC and the FDA are really paying very close attention. So for those of you who've gotten the vaccine, the Johnson & Johnson, and like I said, my niece, my nephew, and my brother all did, and I spoke to each one of them and I said, don't worry, okay? Don't worry. First of all, I'm a phone call away, and I will tell you, don't worry. These are exceedingly rare, 1 in a million chance. And even if you have that 1 in a million, event of a clot, there are good treatments. So don't be nervous. And if people have questions, please call your healthcare professional. All right, I hope that addressed the vaccine nervousness. I will tell you that the B117 strain of COVID is really sweeping through the country and the planet. And I still urge people to get vaccinated. whichever vaccine. Right now, you can't get Johnson and Johnson because the US is putting a sort of a pause on it. But Moderna or Pfizer, please get vaccinated as soon as possible. And for the 886 people that got vaccinated by us, the collective group of us, please know that you are now protected from getting COVID, which is a really important thing. All righty. Well, without further ado, I'd like to welcome you and Dr. Elmer Huerta of the Cancer Center here at the George Washington University School of Medicine and Health Sciences, and Kayla McKinnon, Ms. Kayla McKinnon, who just got accepted and to UCLA. She'll be going to UCLA in the fall, and we're very proud of her. She's been one of our Rodham Institute interns and has just been terrific. We're very proud of her. So one of the things that we've wanted to do for a while now is to really expand and reach out to our Latinx brothers and sisters. And we're just so excited to have Elmer Huerta, Dr. Elmer Huerta, because Dr. Huerta is actually very well known in the Latinx community. He's had his own radio show and TV show, and he's really helped to educate so many people about the importance of cancer screening, about general health topics. And you know, one of the concerns that I have as a physician is that the cancer diagnoses has actually dropped, which is not a good thing. It means that people are not getting screened. So without further ado, let me introduce our translator first, and that's Ms. Kayla McKinnon, for our first ever all Spanish Rodham Institute speaker series. And so welcome, Dr. Huerta, and please unmute yourselves, Ms. Kayla McKinnon, and I am gonna turn things over to you. So Dr. Huerta, would you like to say a few words in English that Kayla can translate in Spanish, and then we'll do vice versa.
All right, Gigi, thank you very much. Good afternoon, everyone. I'm very, very happy to be here with you this afternoon. And I am extremely excited that this is going to be the first bilingual session that we are going to have at the Institute. Well, I just want to also say that COVID is really affecting our communities disproportionately. It
Yeah.
is amazing, but um, we need to really take action on remediating this problem, Gigi, and we are
Yes.
here to start the process.
Thank you. Well, without further ado, please start speaking in Spanish. If you could.
Él dijo que es
Well, you don't need to translate for
Okay.
Dr. Huerta. He'll just repeat it.
Okay. Well, thank you so much. Yo puedo leer su biografía muy rápidamente. Él graduó con su título de medicina de la Universidad Nacional Mayor de San Marcos en Perú, y también ha completado su maestría en salud pública en la Escuela Bloomberg de Salud Pública en Johns Hopkins. Hasta marzo de este año, él fue el fundador y director del Preventorio de Cáncer en el Instituto de Cáncer en MedStar Washington Hospital. Y el Preventorio de Cáncer fue la inspiración por la ley del navegador de pacientes, divulgación y prevención de enfermedades crónicas, y firmada por George Bush en 2005. Like I said, it's wonderful to introduce you, Dr. Elmer Huerta. He graduated with his medical degree from the Universidad Nacional Mayor de San Marcos in Peru. He has also completed his master's in public health at the Bloomberg School of Public Health at Johns Hopkins. And until March of this year, he was the founder and director of the Cancer Preventorium at the Cancer Institute at MedStar Washington Hospital. And the Cancer Preventorium was the inspiration for the Patient Navigator Outreach and Chronic Disease Prevention Act, signed by George Bush in 2005. Bienvenidos. Welcome, Dr. Huerta.
Hola, Kayla. Muchas gracias. Thank you very much. Encantado de estar contigo y encantado de estar también con todos los que están en este momento en la sala.
Thank you so much. Ahora empecemos con la conversación. Let's get started. Por favor, ¿nos puede hablar sobre su mismo un poquito y también cómo la pandemia de COVID ha transformado su trabajo? ¿Cuáles son las ocurrencias nuevas que ha encontrado?
Muy bien. Voy a responder primero en español primero y después yo mismo lo voy a decir en inglés, ¿cierto?
Sí, está bien.
Muy bien. Yo soy médico, soy del Perú y nací en el Perú y vine a Estados Unidos hace 32 años y mi especialidad es en prevención y control del cáncer y soy el director del preventorio del cáncer del Centro de Cáncer del GW University de la universidad. Y pandemia ha cambiado muchísimo mi vida porque aparte de que no hemos podido ver muchos pacientes como veíamos antes, eh, la pandemia ha hecho que trabaje mucho más en lo que son los medios de comunicación. Yo tengo ahora programas todos los días de radio, tengo programas de televisión todos los días, trabajo con CNN en español, soy el médico de CNN en español, de tal modo que mi trabajo ha cambiado muchísimo y ahora hago muchísimo más alcance a la comunidad enseñando todo sobre COVID-19. Well, entonces ahora, now I'm going to say it in English, right, Kyla? Yes? Good.
Sí, ya.
My name is Dr. Elmer Horta. I'm a physician and my specialty is in cancer prevention and control. And I'm the director of the Cancer Preventorium of the GW Cancer Center. My life has changed a lot since the pandemic started. First of all, I haven't been able to see many patients as used to be. We just started the preventorium to see patients at the preventorium in September of last year. And secondly, my work in the media has really increased, representing GW in many media outlets. I have my own daily radio program that goes into Washington, D.C. and the Miami metro area. I'm also the doctor for CNN in Espanol, and I have daily uh, um, uh, presentations at CNN in Espanol talking about the pandemics and trying to uh, make people understand the importance of these pandemics, the importance of preventing the infection, and lately, the importance of getting the vaccine.
Qué interesante. Ok, por favor, usted puede discutir sobre las disparidades raciales en salud, cómo pertenecen a cáncer, which is to say, can you discuss racial health disparities as they relate to cancer?
Claro que sí. Las disparidades, las desigualdades raciales afectan mucho en relación al cáncer en las poblaciones. Por ejemplo, si una persona no tiene un seguro médico, es una persona que no se va a hacer sus chequeos médicos porque tiene miedo de que no vaya a poder pagar la enfermedad que vaya a descubrir. Si es una persona, por ejemplo, que no tiene el dinero suficiente para pagar consultas médicas, no va a ir a ver a los doctores. Si es una persona, por ejemplo, que no tiene acceso adecuado a la salud, no va a recibir el tratamiento adecuado del cáncer. Eso en términos de los tratamientos y la prevención y la detección precoz. Pero también si es una persona que no tiene una buena educación, no va a recibir los mensajes adecuados para prevenir la enfermedad, para diagnosticarla a tiempo, y es una persona que va a incurrir más en comportamientos de riesgo como fumar cigarrillos, comer mal, no hacer ejercicio, desarrollar obesidad y tener problemas que van a aumentar su riesgo de cáncer. Entonces, lo que podemos decir es que las desigualdades, las inequidades tienen un fuerte impacto en lo que es el cáncer en una persona. What I just said in Spanish is that health disparities as it relates to cancer are very, very important. If you have a person who, for example, who does not have health insurance, doesn't have access to healthcare system, is a person who may not go for checkups. Is a person who may not have the right treatment when they get the conditions, or is a person who is going to delay seeing a doctor for treatments. If there is a person that doesn't have the right education, the right information, is a person who is going to incur in behaviors that are going to make them more prone to develop cancer, like smoking, like obesity, not eating well, not doing exercise, etc. Health disparities related to cancer are extremely, extremely important, and we need to take them into account when we fight cancer, and we need to correct them.
Wow, ok. Y es por eso porque la tasa de mortalidad de cáncer es mucho más alto en la comunidad latina que en la comunidad blanca.
Exacto.
Mm.
That's why cancer mortality, cancer in the Latino community is higher than in other communities, comparing to the Anglo-Saxon community, for example, because those health disparities are much, much more prevalent among the Latino communities all over the country. Smoking rates are higher, obesity rates are higher, a lack of access to medical care is higher. So because of all these inequalities, all these disparities, is that Latinos, they have much more higher rates of incidence of cancer and also mortality. Lo que he dicho en inglés, ahora lo voy a decir en español, es the opposite. Eh, es por eso que, por esas desigualdades, por esas inequidades que hemos mencionado hace un momento, es que las comunidades latinas en Estados Unidos no van a ver al doctor. Al no ir a ver a los doctores, no se descubre el cáncer temprano. Al no descubrirse el cáncer temprano, son personas que tienen más tendencia a presentarse con cáncer avanzado y eso hace que los tratamientos no funcionen bien y por lo tanto la mortalidad sea mayor. Por eso es que es muy importante identificar las desigualdades sociales y sobre todo corregirlas.
Awesome. ¿Y cómo usted cree que podemos arreglar eso? Um, ¿Cómo? How can we fix that issue?
Uh, in order to fix health disparities, we need to use a multi-pronged approach. Number one, we need to educate communities. We need to outreach them and let them know that many conditions are preventable, many behaviors are conducive to higher rates of disease. They need to know the scientific facts about eating well, exercising, cancer screening, examinations, etc. Number one is to inform the communities that there are many things they can do. Number two is to work with legislators. We need to work with legislators and make them understand that it's in the interest of the country to educate and to provide access, for example, to these communities that are at this moment lacking access, because having and maintaining a healthy community is going to be in benefit of the whole society. Also, what we need to do is to make sure that health services provide the services in a culturally competent way. We need to have doctors and nurses and all personnel, health personnel who are sensitive to the needs of these different communities, not only Latinos, but also African, Asian communities that need to fulfill their needs by going to these health services. It is, I've been in Europe, as many probably of you in the audience, and when I was in Germany, I was so aghast because I couldn't communicate. I don't know any single word in German. So I was thinking, I was telling my daughter, I went with her, it would be horrible to go to a hospital here and not be able to communicate that I have abdominal pain or I have this symptom on the other one. That is what people feel here in the United States when they cannot communicate their symptoms in the language they speak. Now lo voy a decir en español. La manera de corregir estas desigualdades es primero educando a las comunidades, dejándoles saber a las comunidades que hay muchos comportamientos que son de alto riesgo, comportamientos que nos llevan a la enfermedad y comportamientos que deben corregirse. También se les debe enseñar a las comunidades de que eh, entablando, entablándose y llevando comportamientos mucho más saludables se pueden prevenir y detectar las enfermedades. Pero también es importante, dijimos, trabajar con los legisladores, porque sin leyes adecuadas, sin regulaciones adecuadas que brinden acceso a las comunidades, va a ser muy difícil que se llegue, digamos, a una cobertura total. Y debemos convencer a los legisladores de que va en beneficio del país que todas las comunidades, no solamente las comunidades latinas, inmigrantes, sino otras comunidades tengan acceso a la salud. Y por último, dijimos también que los centros de salud deben estar preparados, teniendo personal que sea bilingüe, personal que pueda entender y que sea culturalmente sensible a las necesidades que puedan tener estas comunidades inmigrantes. Yo creo que de esa manera se puede intentar corregir las disparidades.
Okay, excellent, excellent. Debido a la pandemia de COVID, muchas personas no pueden salir de casa regularmente y por eso no visitan al doctor. ¿Cómo ha afectado este fenómeno en las tasas de cáncer? And what I asked is, COVID has made it so that many people aren't able to leave their homes regularly, especially to visit the doctor like they should. Can you tell us how that has impacted cancer rates?
Yes, we are just starting to evaluate that. There are now some publications that have shown that people who do not engage in early detection are probably at this very moment having the condition just getting advanced, and that's when they are going to see the doctor later on with advanced conditions. Number two is that people who are in need of treatment and they did not go to see the doctor on time, they didn't get the treatment they needed, and that is going to, of course, affect their their prognosis regarding the condition. That's why it is extremely important that we communicate with people in many different ways using all channels that are available for people, telling them that it is secure now to start going out to see doctors. There's telemedicine services they can use, at least to get in touch with their providers. But now many centers are now prepared to receive patients and provide services in early detection and cancer treatment. There's this study that appeared last year in the middle of the pandemics. It was a projection that they said that in the year 2020, last year, there were going to be almost 34,000 deaths in excess due to cancer because of the pandemics, and that is because people did not get the treatment they needed. Lo voy a decir ahora en español. Es cierto, la gente no ha acudido a ver a los doctores y eso es muy fastidioso porque una persona que puede estar desarrollando un cáncer en el colon, un cáncer en la mama, un cáncer en el útero y que por más de un año no ha ido a ver al doctor, este cáncer está avanzando y cuando ya le dé síntomas puede ser muy tarde. Por eso es importante decirle a las personas que ya es momento de que salgan, que se hagan sus chequeos, que vayan a ver a los doctores, que vayan a los hospitales. Los hospitales ya están preparados para recibir a las personas. Existen protocolos de bioseguridad muy rígidos que se hacen en los hospitales para evitar el contagio. El año pasado, se publicó un estudio que decía que aproximadamente 34,000 personas iban a morir por cáncer en Estados Unidos, precisamente porque por la pandemia no han recibido o no iban a recibir los tratamientos que iban a necesitar. Así es que quiero pedirle a todos los que están mirando esto que ya es momento que salgan y que vean a sus doctores para prevención, para detección y para tratamiento.
Excellent. Yes, absolutely. Um, Muchas personas han dicho que han ganado peso debido al estilo de vida causado por mantenerse al salvo durante la pandemia. ¿Usted puede hablar sobre la conexión entre la obesidad, la nutrición y el cáncer? Which I'm to say, many people have reported gaining weight because of the new lifestyle that we've adopted in avoiding COVID-19. So how do nutrition and obesity relate to cancer?
La obesidad y la nutrición y el cáncer están muy relacionados.
Mm-hmm.
Es de una manera indirecta. Los mecanismos exactos no son muy bien conocidos, pero por ejemplo, una persona que tiene obesidad tiene mucho más frecuencia de cánceres relacionados a las hormonas, por ejemplo, cáncer de próstata el hombre, cáncer de la mama la mujer, pero también hay otros cánceres como el cáncer del páncreas, el cáncer del intestino grueso, que están relacionados a la obesidad y por una nutrición que no es saludable. De tal modo que parte de la lucha contra el cáncer es también enseñarle a la gente a alimentarse saludablemente, enseñándole que hay que comer de todo en porciones pequeñas, con más abundancia de frutas y verduras, para que de esta manera, al prevenir la obesidad, indirectamente se pueda también prevenir el cáncer. I just mentioned that uh, obesity and cancer are related, and it is not really well known the exact mechanism by which obesity causes cancer, but there are many cancers that are much more uh, prevalent among people who have obesity. For example, hormone dependent cancers such as prostate cancer and breast cancer are much more common among people who are overweight. Same way with uh, pancreatic cancer and colorectal cancer are also very common among people who have overweight or are obese. That's why part of cancer prevention and control is nutrition, good nutrition. Teach people how to eat well in a healthy way, eating everything in small portions and with an abundance of colorful food like vegetables, like fruits, and doing, of course, exercise on a daily basis in such a way that we maintain a healthy weight, and that is going to prevent cancer. And that's extremely important for people to know.
Awesome. Awesome.
There's a question by Mr. Jose Granados, which says, how can you make healthy, conscious choices if you barely have ends meet to get by, lost your job, or can only rely on food donations in the community for subsistence? And that's actually why we at the Rodham Institute are dedicated to improving health equity, because what you just mentioned is the structural and social determinants of health that really impact, health outcomes. You're right. How can you worry about getting cancer screening if you don't have food on the table? What would you say, Dr. Huerta?
Mr. Granados is perfectly on point. He's right with his comment and his question. That's why it is extremely important to get and work with the politicians in such a way that we provide healthy food in shelters and places that are used by people who have no access to healthy food. And what I can tell also, Mr. Granados, is that there are many community clinics in the neighborhood that can either for free or by a sliding scale to provide services in cancer prevention and cancer early detection. It is, for example, at the Cancer Preventorium, we see people, 85% of the people we see at the Cancer Preventorium have no health insurance. And most of these people, they are workers that they do not have a disposable income, but because they are now educated, I would say they get the right message through radio and television, they understand that they have to save a little bit of money in order to have and pay for their checkups. So I think it's a combination of factors of organizations like government, etc., the mayor's office providing them the food they need, but also the personal responsibility of people to understand that even though they may be very short on resources, it is important for them to do it. Acabo de decirle que el señor Granados ha preguntado cómo si una persona no tiene plata para comprar comida saludable, se va a preocupar por comprar comida saludable que generalmente es cara. Que no le alcanza la plata, ¿cómo se va a hacer chequeos médicos si no tiene plata? Y tiene mucha razón el señor Granados con esta pregunta y mi respuesta ha sido, de que por eso es que necesitamos trabajar con los políticos para poner alimentos saludables más baratos en la mesa de las personas que tienen menos recursos, pero también tenemos que educar a las comunidades. En el preventorio, por ejemplo, del cáncer que tenemos en la Universidad George Washington, vemos a pacientes que son personas muy pobres, pero que han entendido que la prevención es importante, ahorran su dinero para poder pagarse su chequeo médico porque ya entendieron que si ellos no se cuidan, si ellos no se ayudan a sí mismos, pues nadie los va a ayudar. Yo creo que es una, como dije, una cuestión de combinar la responsabilidad personal, pero también la asistencia que le puedan dar las organizaciones.
Excelente, muy excelente, sí. ¿Cómo se haría uno para hacerse un examen de detección del cáncer? ¿Y cómo importa la edad? How would one go about getting screened for cancer, and how does age play a role?
Eh, Cancer detection and cancer prevention is a specialty that what we try to do is to educate people in how to prevent cancer. We have to remember that there is what we call the primary prevention, which is trying to avoid contact with any known substance or behavior that produces or causes cancer. And early detection means that the cancer has already started, but we have tests that we can find the disease before it spreads. In terms of prevention, we have to do everything in our power to teach people that smoking is the number one cause of preventable death in the United States, that there are many types of cancer and also heart disease that's related to smoking. So smoking is one big enemy that we need to fight in our communities, but also exposure to the ultraviolet light in the sun causing cancer skin. Also, um, sexual intercourse without protection can uh, um, disperse a human papilloma virus, HPV, that may be the cause of cervical cancer. So, or hepatitis B infections, for example, in the same way, or hepatitis C that can cause cirrhosis of the liver and liver cancer. So there are many diseases that can be prevented if people know how to do it. And in terms of early detection, what we do at the Cancer Preventorium is a complete physical examination. We examine the patient from head to toe and trying to focus on the examination of the skin. And many times we find something in the skin that can be biopsied and found a cancer, but also we do pap smears that can detect cervical cancer. We order fecal occult blood tests, which is a hidden blood in your stool that can give us a idea the cancer in the colon may be developing, or do colonoscopies. We also have the mammograms to detect early breast cancer. We have low dose CT scan of the chest to detect lung cancer among people who have smoked during their lifetime, at least one pack a day. So there are some tests, or the PSA and the prostate and the digital rectal examination among men for prostate cancer. In other words, the specialty of cancer prevention and early detection and control is a solid specialty. If we, as somebody said many years ago, if we use everything we have in order to prevent cancer, and we use all the tests that we already have now, we can avoid 100,000 new cases of cancer every year and avoid 60,000 deaths every year just by doing what we know and by using what we have at this moment. En español, lo voy a decir. La pregunta fue, ¿cómo podemos hacer prevención y detección del cáncer? La idea de la prevención del cáncer es que tenemos que darle a las personas el conocimiento para que, por ejemplo, no fumen o dejen de fumar, porque el cigarrillo está íntimamente relacionado a muchos tipos de cáncer, además de las enfermedades del corazón. Pero también el exponerse a la luz ultravioleta puede causar cáncer de la piel y tenemos que educar a la gente en cómo no exponerse a la luz del sol. pero también las relaciones sexuales pueden llevar a que las personas tengan el virus papiloma humano y esto pueda causar cáncer del cuello del útero. También trabajar con vacunando personas contra la hepatitis B. Es importante porque la hepatitis B puede llevar a la cirrosis del hígado y al cáncer del hígado. Es decir, hay varios tipos de cáncer que están relacionados a lo que es la prevención y se pueden prevenir. Y en términos de detección precoz, pues lo que hacemos en el preventorio es examinar a las personas completamente de pies a cabeza, como se dice, y luego lo que hacemos es hacer exámenes que están encaminados a la detección de los cánceres que tienen pruebas. El Papa Nicolau para el cáncer del cuello del útero, el examen de sangre oculta en los excrementos y la colonoscopía para el cáncer del colon, la mamografía para el cáncer del pecho, el examen digital rectal y la PSA para el cáncer de la próstata, el examen de baja dosis de tomografía axial para personas que han fumado mucho y poder encontrar el cáncer del pulmón. Es decir, sí se puede hacer prevención y detección del cáncer. Lo importante es que la gente sepa que existe esta especialidad y vaya a buscar a los médicos que la hacemos.
Bueno. ¿Qué consejo tiene usted para una persona que ha sido diagnosticado con cáncer, pero tuviera miedo de visitar a su oncólogo durante una pandemia? What advice would you give to somebody who's been diagnosed with cancer, but they're concerned about leaving their home to receive treatment from their oncologist right now?
The person who has cancer or has a suspicion of cancer, they need to understand that, of course, pandemics is horrible and they may get infected with the virus, but the chances of getting a complication because their cancer is either not being diagnosed or is not treated on time is higher than the possibility of having a problem with the virus. So, number one. Number two, we need to make people understand that if they take all the precautions, which is the face mask and the social distance and the making sure that the provider is fulfilling all these biosecurity regulations that we have nowadays, the chances of getting infected are very low. Therefore, they need to see their doctors because a good diagnosis and a good treatment are essential in fighting cancer. And the benefits of doing that early are going to be much, much higher than the fact that they may get infected with the virus. In Spanish, I'm going to say, si una persona tiene alguna duda que tenga cáncer, por ejemplo, le han encontrado algo en la mamografía o algo, o tiene cáncer ya, pero tiene miedo de salir, lo que le tengo que decir es que va a perder mucho más al quedarse en la casa que al salir y ver al médico, porque ahora ya sabemos cómo cuidarnos del virus, usando una mascarilla, un barbijo, manteniendo la distancia con las personas y además ya los centros de cáncer, los consultorios están preparados para recibir a las personas y que no haya contagio. Yo creo que una persona tiene mucho más riesgo de poder complicarse si es que no ve al doctor teniendo un cáncer que de infectarse por el coronavirus.
Bueno. Si una persona está recibiendo tratamiento por cáncer, ¿debe conseguir una vacuna para COVID? ¿Por qué o por qué no? Should a person currently getting treated for cancer get the COVID-19 vaccine or why? Why or why not?
Yeah, now the cancer organizations in the United States, they have already said it very clearly. Patients with cancer, even when they are receiving treatment, they should get the vaccine. The American Cancer Society, the American Society of Clinical Oncology, they say that a person with cancer, they need to get the vaccine. A cancer survivor, they need to get the COVID vaccine because they are high risk groups to get complications if they get the disease. What we don't know, also, there are some reports saying that they do not have a good amount of antibodies after the vaccination is to determine if they need a third dose of the vaccine or no. That is something that doctors, they need to study, but they need to get vaccinated. People who are cancer survivors or people who are getting treatment. They say, for example, if somebody is getting treatment, they have to wait to the period of time between chemotherapy courses to get the vaccine. So it is important that people understand that cancer patients and cancer survivors, they may be a high risk group, therefore they need to be protected using the vaccine. En español, las sociedades médicas en Estados Unidos que tienen que ver con el cáncer, como la Sociedad Americana del Cáncer y la Sociedad Norteamericana de Oncología Clínica, recomiendan que las personas que han pasado el cáncer, que tienen historial de cáncer, supervivientes de cáncer, se vacunen. Y también las personas que están recibiendo tratamientos de cáncer deben vacunarse. ¿Por qué? Porque son personas de riesgo a que si les da el COVID-19 se van a complicar. Por eso es que deben vacunarse. Y lo que se dice, por ejemplo, es que incluso una persona que está recibiendo quimioterapia debe esperar entre tratamiento y tratamiento para que pueda recibir su vacuna.
I see that there's a question from the chat from Ms. Stephanie Hafez. What are some of the socioeconomic and cultural factors that contribute directly to cancer prevention and outcomes in the Latinx communities?
When we talk about the Latinx community in the United States, we have to understand there are two very different groups. Number one are the Latinx who are immigrants like myself. We came here as an adult or as a children, as young people, and we are living here now. And the second one is the Latinx people who were born here. And the characteristics are completely different as they relate to cancer control, cancer prevention, cancer early detection. For example, for people who are immigrants, they usually come from countries with prevention and early detection are not strong services in their healthcare system. Therefore, they don't know much about cancer prevention, cancer early detection. In addition, they are not in a socio-economical position that allows them to eat well, to exercise. They need to work long hours, and determines their obesity rates, and that, as we said before, increases the risk of cancer. Also, the immigrant community, they have, many of them, chronic infections by Helicobacter pylori, which is a bacteria that infects the stomach, or they have history of hepatitis B, hepatitis C. They come from their countries and they develop here cirrhosis of the liver, of chronic gastritis and stomach cancer. So there are certain cancers that are much more frequent in this immigrant community. People, Latins who were born here, many of those communities, they have no access to healthcare. They, even though they speak the language and they are, of course, Americans, they also, they don't get the right message in terms of prevention and early detection. And that's something that, as we said before, may determine their willingness to go to see cancer prevention doctors, early detection, and that's another set of problems. So I think it is important to understand that the Latino community is not a homogeneous group. There are also people from many different countries, 20 different countries, and some of these groups are completely different to each other. So that's why researchers, we need to take into consideration these differences in such a way that we have the right messages and we know how to outreach them in a proper way. En español le voy a decir, la pregunta fue, ¿qué características tienen las personas latinas en este país que los predisponen al cáncer? Y dijimos que existen dos grandes grupos de personas latinas en este país, las que han venido como inmigrantes, ya nacidos fuera del país, y los que han nacido ya en este país. Los inmigrantes generalmente vienen de países en los cuales no hay una cultura adecuada de prevención y detección en sus países, llegan aquí, tienen que trabajar muy fuerte y no piensan en prevención y en detección precoz. Además de eso, la condición sociocultural económica no es tan fuerte, no tienen acceso, no tienen seguro médico y entonces eso impide que tengan buenos servicios. Y a las personas que han nacido aquí, a pesar de que hablan bien el inglés y tienen acceso a la salud, los mensajes de educación no son los adecuados y también tienen esa característica de sufrir más cáncer.
If I could just jump in, I think whatever group we're talking about, whether it's the elderly or immigrants or African Americans or Latinx or LGBTQ, we cannot look at people all as one group. There are actually, they look at human beings, and probably people have more in common with other people of class backgrounds from different countries or educational background. They have more in common with them than sometimes people within their own country. And reasons for immigration really impact the kind of health behaviors that people have. So, for example, if people are coming from areas where there's been war or there's famine and they have immigrated here to escape those situations versus coming here for education, right? That's very different. Can you comment on that, Dr. Huerta?
It is very true, Gigi. It's very true that communities, and speaking specifically about the Latino community, they are so diverse that if you do not take that diversity into account, you will fail in outreaching them. Messages, they need to be tailored to different communities, because if you don't take that into account, the message is not going to resonate. Simple things such as idiomatic expressions are so different between communities, the Latino communities, that if you think that one message in Spanish is going to be understood for everybody, you may find a surprise and you will realize that it was not understood or it was misunderstood for communities. That concept is extremely important, Gigi, the diversity of the community.
I guess I'll have you translate that because that's so important.
Okay. Disculpa, I'm sorry. Bueno, lo que acabo de decir, lo que dijo la doctora es que cuán importante es tomar en cuenta la diversidad de las comunidades cuando uno se dirige a ellos. Y lo que he dicho es que en español tenemos, perdón, en las comunidades latinas tenemos que ser muy, muy conscientes de los diferentes grupos, que somos de 20 países diferentes, con costumbres completamente diferentes y que incluso tenemos un uso del idioma español con ciertas variaciones idiomáticas, y si uno no toma en cuenta esto y quiere usar solamente un tipo de español, a veces o no va a ser bien entendido o al revés, va a ser mal interpretado por las comunidades porque los mensajes no llegan bien. Las personas, sobre todo los investigadores, el personal de salud que trata de llegar a la comunidad latina, tiene que conocer a la comunidad y tiene que saber con qué grupos está tratando para que de esta manera puedan tener una mejor comunicación.
Excellent. We actually have a question in the Q&A. It's from Jose Granados. It says, what can we do proactively as research institutions to ask or demand more policies and hold politicians accountable to expand or fund initiatives for more access to programs of health screenings that are free or low cost for low-income community members? And I guess I would say, cómo las instituciones de investigación de manera proactiva exigen que más legisladores amplíen los fondos para iniciativas activas para exámenes de salud más accesibles y gratuitos para los miembros de la comunidad de bajos ingresos.
That's a very good question.
Mm-hmm.
In my experience, you have to demonstrate legislators in economical terms. That's what I have really learned, that when you demonstrate with numbers that not doing something, in this case, not providing, for example, cancer prevention, cancer screening services for this community is going later on to increase the amount of money that we dedicate to treat advanced cancer, and those monies are going to be write off by the hospitals, etc. That's when they will understand that it is extremely important to provide this kind of services for the community. That is unfortunate. It shouldn't be that way. That money can be decisive or a decisor, I would say, in this kind of this, situations. But that is one thing that we need to do. Of course, we need to also um, talk to them in terms of the importance, because they're politicians. And that if you're asking about politicians, they are always looking for some kind of recognition from their communities. So if you show them that by doing something for communities of color, communities, underserved communities, is going to look very good on them, that's also they will do it. Of course, there are many politicians. They do it just because it's the right thing to do, but sometimes you have to go and demonstrate them. It makes economical sense and is going to be good for them too. En español acabo de decir, la pregunta fue cómo podemos hacer que las universidades o los grupos convenzan a los políticos para que provean servicios de prevención, detección del cáncer. Y lo que hemos dicho es que hay que enseñarles los números, hay que decirles de que cuando ellos propician programas de detección precoz, se va a encontrar la enfermedad más temprano y eso va a evitar cáncer avanzado y gastos futuros que van a salir de las municipalidades o los estados, y eso va a ahorrar dinero. Y también, obviamente, que el tener una acción adecuada con los grupos minoritarios es muy bueno para el trabajo de los políticos, y eso lo van a entender.
Excellent. Yes. Okay. Really quickly, I want to ask, is it necessary to wait a certain amount of time in between cancer treatments in order to get the COVID vaccine? I just wanted to touch on that. ¿Es necesario esperar entre tratamientos por cáncer antes de conseguir la vacuna por COVID?
Yeah, what the American Society of Clinical Oncology says is that if you are getting chemotherapy, for example, and you get a 1 week of treatment, and then you wait until 3 or 4 weeks until your next treatment, in that period, in between treatments, that is the best time to get the dose of the vaccine. La pregunta ha sido, ¿en qué momento del tratamiento del cáncer se puede dar la vacuna? Y, por ejemplo, si alguna persona está recibiendo quimioterapia, generalmente se da una semana de tratamiento y viene el próximo tratamiento en 3 o 4 semanas. Es decir, en ese interín, en ese espacio, allí se puede recibir la vacuna.
Gracias. It looks like we're getting close to the end. Para terminar, yo quiero preguntar, ¿usted tiene algo para decir a nuestra audiencia sobre cáncer y sobre consiguiendo un examen de detección del cáncer? Just anything else. Do you have anything else that you want to tell the audience about cancer and getting screened?
Yes, it is extremely important for us to understand that out of more than 200 different types of cancer, none of them give you symptoms when they start. Cancer is a very silent condition. It is very rare for a cancer to give you symptoms when they are starting. So, said that, it is very important to understand that it, it's, it's imperative for us to see our doctors at least once a year, for the doctor to ask questions about our general health and to perform some tests that can be done on a certain frequency. Mammograms, the pap smears, the FOBTs, the colonoscopies, all these tests need to be done in order to find cancer. So, what I'm trying to say is that knowing that cancer is a very silent condition, it is important for us. It is up to us. It is our personal responsibility to approach our doctor, see regularly to our physicians, and try to find out early cancer. Of course, there are many cancers that have no tests. there are no early detection for certain cancers. But even though if we see the doctor regularly and when the doctor asks questions, they can detect some symptoms that are getting, uh, uh, they're appearing, and though maybe guide them to do some tests and find an early condition. Lo que he dicho en inglés es que una persona, la pregunta ha sido si quería decir algo más. Y lo que yo le quiero decir a todos en español es que el cáncer es una enfermedad muy silenciosa, no da síntomas cuando empieza. Por eso es que es muy importante ver al doctor una vez al año para que el médico haga pruebas en nosotros, las pruebas del Papa Nicolau, de la mamografía, del colon, de la colonoscopía, de la próstata, del pulmón, y también nos haga muchas preguntas. De esta manera nosotros vamos a poder encontrar la mayor parte de los cánceres temprano antes de que avancen. Y solamente terminar diciéndoles que es responsabilidad de cada uno de nosotros hacer todo lo necesario para que el cáncer sea encontrado temprano.
Excellent advice, es tan importante. Muchas gracias por hablar con nosotros hoy. He aprendido mucho sobre esto. Thank you so much. I'm going to hand it back to Dr. Gigi to
Okay.
close this out.
Well, first of all, excellent moderator with excellent translation.
Thank you, Kyla. Yes.
Yeah, I mean, I was so amazed when you were asked a question and you just translated it. You did a great job, and we are so proud of you, our Rodham Institute intern and future UCLA Bruin. So proud of you.
Wonderful.
Yeah, really. Dr. Huerta, we hope that this is going to be the beginning of many webinars, as well as projects and programs that we are going to be doing together. What you're saying over and over again, and I'll let you translate at the very end, is that everybody wants to be treated with kindness. Everybody wants to be seen for who they are, no matter where they're coming from. And everybody wants to live to their maximum potential. And so, we want to amplify all the great work that you're doing to get people who are maybe Spanish speaking only, and even if they're not only Spanish speaking, if they feel comfortable with you and your approach, right? That to me is just as important. So we thank you, Dr. Huerta, and if you'd be kind enough to translate how much we thank you and how much we love you.
Well, that's going to be difficult, pero yo también los quiero mucho a ustedes y esto va a ser la primera vez. No va a ser la primera vez. I'm just saying this is not going to be the first time. I'm here to work with you. I love what you do in the Institute, Gigi. I really, I'm very happy to having the opportunity to work with you. And Kyla, again, gracias. Tu español es muy bueno. Thank you very much. And thank you very much, Gigi. I love you too, a lot.
Oh, thank you. And for those of you who are Muslim in the audience, كل سنة وانتم طيبين, Ramadan Kareem, Ramadan Mubarak. And please take care, everybody. We'll see you the next time. Bye-bye.
Bye. Thank
Bye-bye.
you.
Thank
Bye.
you.
Bye-bye.
Bye-bye.
Bye.